Hey class, happy Wednesday. Dr. Doug Brown here, checking in. Sort of a coffee break session, if you will. It's still a bit early here in the central time zone. If you're out west, obviously it's a bit earlier than it is here in the central time zone. And it's an hour ahead in Eastern. So nevertheless, whatever time you are watching this, whether it's early as it is for me, or late. Hopefully you're having a fantastic day and all is well. So we're entering the midpoint in the term. It's almost over. I think we end or turn in grades the 26th of December perhaps, and hopefully we'll have everything in and graded by Christmas. That's certainly my goal. I wanted to check in on this Wednesday and remind and congratulate more than anything else each one of you for all the fantastic work you're doing on the assignments and the discussions, the journals, the red papers, etc. Please remember that your journal assignments should look like your discussions. Essentially, they need to be extended, in depth, detailed, lots of information. Doesn't have to be a book, but it does need to be, multiple sentences, certainly more than a couple. Needs to be supported. Please check your grammar and make sure that you stay on point. Just follow that rubric and the instructions. That will help you along with the example posted in the announcement. Same thing with the discussions. Make sure you stay on point and follow that example. As we move forward, I'm always a little bit lenient those first couple of assignments in order to help you, but as we move forward, obviously, we should be at a point of having most of that down and at least understanding what those instructions say in the examples. So I start deducting more points as we get along. The final, I really scrutinize that because we should be on top of our APA, our grammar, and those things that we've talked about. So I'm not as lenient on those final assignments as I am the first couple. So just keep that in mind. I always try to help. That's my goal, is to teach, not just focus on the grade, but that's academia. We all have to work hard to learn. That's why we're here. So now that point's made, sort of a reminder, the Bayless case. Last week, week 3, we talked a lot about the Bayless case in our discussions. A couple of the assignments typically end up being controversial and very busy. The Bayless case is one of them. Second case is civil commitment. That sometimes can be a very busy, involved in intense discussion because of the way it impacts American society, the things involved with civil commitment, and then as we move forward, our discussion on terrorism and the changes to laws since the 9/11 attacks, such as the Patriot Act, etc. We'll talk about that soon. So, as we mentioned in the Bayless case, there's not always a good answer for everything that occurs. There's not always a good answer. We as human beings like to blame others. We like to identify fault for a couple of reasons, and one of those I think is just because it's human nature. The second thing is we like to try to fix the problem whenever possible, although we are more reactive than we are proactive. So, in the case of this Bayless CPR case, where the administrator did not perform CPR, even though she has completed, we don't call it certified anymore as an instructor for American Heart, BLS, we don't call it that, but has completed and has been checked off on completing a basic life support course and possibly some advanced life support courses. It depends on her role before as to whether or not she's completed those. But nevertheless, she has knowledge and has demonstrated to an instructor that she can meet the requirements of the American Heart Association. Likely, I don't know that. It could have been Red Cross, but they're about the same. She knows how to perform CPR. And in this case, she made the decision not to perform CPR because it was what the company policy dictated. The facility's not licensed for medical care. It's just, more of an apartment complex, condominiums, where they provide, may help with the medicine or something to that effect, and otherwise call for assistance. But that's not a nursing home. So there's some controversy there as to whether or not she should have performed CPR or not. And we know that there's a difference between what's ethical and what's legal. And did she break the law? Not in California. Most states don't have a law that requires you to provide aid. I believe Connecticut does, maybe, but it's not something that most states do, certainly not in California. And she didn't provide aid because she would have lost her job had she done that, and she may have been sued had the family become upset. So it's one of those catch-22s. What do? You got to have a job. You need the job. And in this case, she elected to do what the boss said, and that was not doing CPR. Is it right? Is it ethical? From a standpoint, we could look at that either way and say, no, we don't believe it's ethical because she should have performed CPR. She knows how to perform CPR, and she let this person die. She was playing God despite the patient's age, condition, and what the family stated. On the other hand, had she performed CPR, she would have broken the company policy, which dictated she cannot perform CPR, and possibly broken state law because they are not licensed as a long-term care facility. So what do? In this case, she said, I'm not going to perform CPR. She's an elderly lady. No one wants to perform CPR on her, or they don't want us to. And it's against policy, so I'm just not going to do it. We're just going to let her pass. So we see this every day. So one of those things to be concerned about, but hopefully represented, the difference between what's legal and what's ethical. So anyway, moving on from the Bayless case. But we do that sort of this week as well with civil commitment, and civil commitment has changed in the United States. Some of you have already posted. Thank you. Civil commitments change. When the federal government mandated that the mentally ill could not be institutionalized the way we were keeping them, it was unconstitutional. So they opened the doors, put them on the street, and that's hard to get some of that medical care for psychiatric patients. Now it's still available, but there's a shortage of beds, and for one thing, there's no money for hospitals, very little money. They don't really make any money on psychiatric care. Those long-term care facilities that do, such as the state mental facilities, I guess they're supported by taxpayer dollars, Medicaid, Medicare, etc. But from a private insurance standpoint, for-profit hospitals and even non-profits don't really make very much money on psychiatric care. So there's not very many beds. I can tell you from being a pre-hospital healthcare provider, having worked on the ambulance and the communications, sometimes you have to hospital shop to find a psychiatric facility that's open and willing to take a patient, and that may require you driving 2, 3, 4 hours across state, sometimes to a nearby state, in order to get that patient admitted on a psychiatric hold. So that's something to think about. But in this case, we are talking about civil commitment for a variety of reasons, where it's mental health, patients who have been convicted of sexual crimes, for example, Maybe they're a convicted sex offender. A lot of times they are committed to a long-term facility, mental health facility, because the courts and the healthcare provider, the physicians, they feel as if they're not cured, they're not well, they don't need to be in the community. And so the community, people in the community don't like this. I don't know the percentages, but I would imagine that if you asked 10 of your friends, probably 9 of those friends would tell you, 8 to 9 of those friends would probably tell you that they don't want people in the community living near their children that has some sort of a condition, whether it's having been convicted of, sexual misconduct, or even having some sort of drug problem, anything that would potentially put them or their family in danger. So whether or not that would still happen is up for the debate in each individual case. But most Americans don't like it. So we don't want people in their neighborhood living across the street, nearby, whatever. And we even see this with group homes, where neighbors don't want group homes in their neighborhood or nearby because they don't want those people around. They feel unsafe. They're different in their terms, not mine. And so many times there's pressure to institutionalize those people that are different, those people that have been convicted of a crime, but they've served their role, they've paid their debt to society, yet the prosecutors, the physicians, politicians, I would even debate, that may not agree that they are well, and they don't need to be, for safety's sake, they don't need to be in the community. So that's a thing that we have to think about this week. We have to look at, again, like the Bayless case, what is ethical, etc. And I assigned you positions. So I assigned you for, I assigned you against in the announcements. Make sure you look at that, and that sort of hit and miss. I don't have any way, without doing a poll, I don't have any way of knowing if you support or you're against individually without just assigning you randomly based upon your last name. So I really want you to take a different perspective, hopefully, and then share your thoughts on civil commitment, on the legalities of this, the ethics, the morals of civil commitment. What do we do in the future? And let me know what you think we should do in the future. Do we do group homes? Do we do outpatient treatment? Do we have those people that have been convicted for sex crimes? Do we put a sign in the yard? That's been proposed instead of civil commitment. What do we do besides committing these patients, these individuals? How do we protect the safety of the community while ensuring that they get treatment? What about the ones that are in prison? Why not just let them stay in prison? They get treatment in prison, right? Or do they? So that's it. I've had you about 15 minutes. I know you're tired of talking to me. Let me know if you have any questions or need my help, and I will gladly help you any way I can. If you need an alternative format, please let me know, and I will be glad to help you with that. So keep rocking, keep up, have a great week. Read my comments, read my feedback, look at those examples and those tips and those templates that I've posted, because I want you to be successful. Reply to your peers, 2 or more peers, and keep rocking and keep moving forward. We're almost finished. We'll be done by Christmas. That'll be a great Christmas present for you, right? And you won't have to look at my beautiful face anymore. Thanks for staying on top of everything. Keep rocking. If you need me, call me.